Recording in progress.
Good afternoon, everyone, and thank you for joining us for today's webinar. My name is Donna Chow, and I'm your host and your moderator for today's eLotus webinar. eLotus is your leading provider for continuing education for acupuncturists, and today's webinar is Quick and Easy System for Learning Pulse Diagnosis, presented by Tina Chen. So before we begin, let's do a little housekeeping. Today's webinar will be from 1 to 5 p.m. Pacific time, and we will have 3 breaks. If you have not done so already, please do get a copy of your lecture notes from the Blue Course Access page in your account. And if you would like to join the chat, please do the following right now and set your chat preference to everyone so that everyone can see what you're typing. You'll have to do this manually because the default setting allows only the speaker and staff to see what you're writing. And if you have any questions during the presentation, please type them into the question box in your Zoom control panel, and our speaker will answer the questions as time allows. The quiz and video replay will both be available tomorrow, and I will send you guys an email notification when they're ready. All right, so today's speaker is Tina Chen, who will give an introductory workshop to assist you in obtaining a clearer and basic understanding of Dr. Jimmy Chang's pulse system and better comprehend and use it in your clinic for diagnosis and patient confidence. She'll also discuss auricular and palm diagnosis used by Dr. Jimmy Chang so that you can familiarize yourself with all of his diagnostic protocols. Tina previously taught an auricular course with us, which is now available for purchase as a distant learning CEU video. For an easy to understand and simplified introduction to Dr. Li Chonghuang's auricular medicine, this is the course for you. It's filled with many clinical pearls in such a short amount of time. And it's both an introduction and a summary of the most important points of Dr. Huang's auricular system. I'll post the link for you guys to her auricular class for you once I return to my computer. All right, so let's begin today's class and welcome Tina Chen.
Testing, 1, 2, 3. Good afternoon, everyone. Can you all hear me? Please type yes into the chat room. Test our audio. Great. All right, wonderful. It's nice to be here. Good to see you guys. Although I see your names, I don't see your faces, but it's great to see your names. I know you're here with me. Today's class is on Dr. Jimmy Chang's pulse system and how to make it easier to learn. I am his eternal student, as you know. I first met him 20 years ago. And ever since he started ordering herbs for me, I really learned that he knows a lot. And from then on until now, I just keep on learning new things because I guess you can never catch up because he keeps seeing more and more patients, you know. So that's why I decided to give a class because he is now in his 70s. And I feel like, I don't know when he will retire or when he will stop teaching, you know, that's all hard to say, but it's not every day where you encounter a master who can speak English and, you know, so accessible too. So it's such a shame if people don't learn this style because pulse diagnosis is very revered in Chinese medicine, as you know, all different types of different protocols we learn. Almost every Chinese doctor in China eventually want to get to the level of just doing pulses and prescribing herbs. So hopefully I can shed some insights for you from my years of learning with him to let you know a little system to break it down so that it's easier and I guess, palatable for learning, to get interested in it, because it could be very overwhelming if you just look at his system at first. Okay, so before we start, let me know, can you type in the chat room for me how many of you are new to Dr. Chang's system? Because this is supposed to be a beginner's class. If you are new, can you put in new in the chat room? Okay, totally new, good. So how many of you have had classes with him or have studied with him at least for 1 year? 1 year. Can you type in 1 year in the chat room? Okay, good. Not many of you. Okay. Okay, good. Now, how many of you, when you were in school, some of you are students and some of you, are practicing for a while now, and we have all sorts of levels here. So I'm just curious, how many of you have this experience that I had when I was in school, which is you're in the clinic, you're following one clinic supervisor, and he takes the pulse of the patient and tells you, oh, this patient has XYZ pulse. And then there you come, another supervisor might come in and then they'll tell you, okay, well, this patient has ABC pulse. And then you take it and then you're kind of confused, well, I'm not sure if it's XYZ or ABC. I'm getting like HMK, something else, feeling something else totally. So it's very confusing. Pulse taking is very subjective. So I think all of us probably have this experience, right? So it makes this art even harder, I think. Okay, so I want to ask another question before we start is, be honest, okay? How many of you, when you're feeling the pulses, you still don't know what you're feeling in the clinic? It's kind of like an adjunct to your intake. You're looking at the patient, you're asking questions, and you're taking pulses just kind of like, because I have to take pulses because it's part of TCM. I'll be honest, I'm like that. I was like that in the beginning, take some pulses, okay? I had to take the pulses and I had to think to myself, okay, so what was the next question I had to ask my patient, But then the patient is probably thinking, oh, she's concentrating on my pulses. But in reality, in the beginning, I didn't know what I was feeling at all. The first few years after graduation and the first few years learning with Dr. Chang, I had no idea what I was feeling. I didn't feel anything. And the conversation between me and him often went like this. He'll say, hey, do you feel this? And I feel it. And I said, no, I don't feel anything. And then he would say, what? It's so obvious you don't feel it? No, not at all. So it was like that, for a long time, because his clinic is right here next to my office. So sometimes when I have time, I would go over there and intern with him, see some patients. And because it was so convenient for me, I didn't really pay attention that much to it, as opposed to other students who flew in from different parts of the world, to study with him for a few days. They really concentrated a lot, when they're taking the pulses. For me, it was just like, okay, I can go anytime, right? So I didn't pay attention as much. So as a result, it took me a little longer, just to be honest with you. In the beginning, it's very normal that you guys don't feel very much, because that the sensitivity of the fingers, you need practice. It's not something where, you go through my 4-hour class today and then tomorrow you'll be a master. No, it's not like that. Okay. So today, just to give you an overview of what the lecture layout today is the first 2 hours. I want to give 2 hours or a little bit over. I want to give you an overview of his pulses. So let's see. Let me go here. Okay, so I am going to introduce Dr. Chang, his pulse taking system. I'll go over the basics of how to take a pulse, compare his method and the traditional method we learn in school. And then after that, I will go over more in detail, a little bit only, about how to summarize all of his pulses and break it down into, simple ideas and framework that you can remember easily, because it's very overwhelming if you first study with it. There's so many pulses and so many minute details that it can be very confusing. Okay. And then after that, I'll go over other pulses that he discovered, which are not the regular 寸关词. So for example, the brachial pulse, the heart 7 hormone pulse, and the Bagua pulse. I'm just going to introduce what they are to you so you know what you don't know, but you don't really need to master any of it, okay? Just today, just sit back and sort of listen for fun. It's an intro class to what is available in his style of pulse taking. Is by no means for you to, be able to digest everything today, because what I'm going over today may be only 10% or 20% of his knowledge. Okay, so don't stress yourself out. That's not for optimal learning, because this stuff you need to digest slowly, okay? And then next, after that, I'm gonna go over what do you do with this basic information that I'm gonna teach you today? How do you apply it in your clinic tomorrow, okay? And then I will also do a little comparison of the traditional. I have a chart in there that I compiled together, comparing the traditional pulses and his pulses, and what are the similarities and what are the differences, So then you can take a look at that. That will be helpful, because as you start studying it and as you start to get into the terminology, you will have a lot of questions, okay? And then after that, the second half, or the last 1/3 of the class, is I'm going to go over his other methods of diagnosis, like the blood pressure reading. I go over his auricular, his hand, and his palm diagnosis. I'll go over some other teachers that I learned from too, because since I thought when I was putting together lecture notes, I thought, oh, might as well put down everything I know from the other teachers too, It's not Dr. Chang's palm diagnosis, but it's also helpful. It's, all in that general area of topic. So I put them all in there for you. And then a little bit of herbs at the end, Dr. Chang's favorite formulas to use. So you have an idea, a broad overview of how his treatment style is like and what he does in the clinic. Okay. Okay, so who is Dr. Jimmy Chang? I'm sure everyone here probably knows about him. He's been here more than 20 years, and he's taught with the E-Lotus for about 20 years too. So at one point or the other, if you have been around that long, since 20 years ago, you've heard of him and probably have taken a class or two with him. But did you continue? That's another story, because he is a little bit of a difficult teacher to follow. So he is a genius, he is self-taught. He never went to Chinese medicine school. He has some sifus that he learned from, but he never went to school. He learned from the books himself. And then he took the Chinese medicine exam in Taiwan, which is very hard to pass. I think the passing rate is maybe like only 5%. So there are not a lot of acupuncturists, licensed TCM practitioners in Taiwan, because it's so difficult. And he's not from any lineage. He discovered all these special pulses himself, through going to the hospitals. And I remember him telling me about going to the hospitals. Each week he would be in a different department trying to feel all their pulses. So then he concluded with what he has taught us today from all his own experience, basically. So in the past, when he was younger, before he came to America, he saw probably 100, sometimes 150 patients a day. And he worked into the evening. These guys, they see patients starting 5 o'clock in the morning before people go to work. And then they would have their afternoon break a bit. And then from 5 o'clock, they would start to see patients until about 10 o'clock in the evening. And he had, I think, 4 or 5 staff in the pharmacy working to mix the herbs together, and another couple staff in the front desk. So all really he had to do was just feel the pulse. So that's how he was able to see so many. Okay. Let's go to the next slide. So in 1997, he moved here and we met. And since he's been teaching 20 years ago, he's taught many people. I think some of you might have learned from his students, like Bob Dong, Chris Valesky, Brad, Eileen, myself, and a couple of other Spanish-speaking speakers. So more and more people are getting to know this system, which I think is very good for today's practice, because one of the main key points of his system is that you're able to take the pulse and tell them their Western medicine diagnosis. With the traditional way of taking pulses, you're not able to. You can only tell in deficiency, Qi deficiency, blood deficiency, right? Heat or cold. And when you have these kind of TCM diagnoses and you're telling your patients this, it doesn't really make much sense to them, So if you can diagnose, oh, you have a gallstone, oh, you have mitral valve regurgitation, or oh, you have gas, oh, you have a viral infection in your lungs, that's a lot more convincing, and you guys are speaking the same language. I find that very helpful, both in diagnosis and also in gaining patient confidence. Okay, so if you want to know more about Dr. Chang, Lotus did a 3-part interview with Ivy long time ago. We interview how he became a Chinese medicine doctor, how did he start teaching and all that. So, the links are in your lecture notes. You can go on YouTube to watch, because it's not easy. It's not easy to become a master. He put in a lot of hard work. So if you want to one day become like him, you also have to put in a lot of work. And thank goodness we spent so much time with him, with many dinners and many beer. He was very happy. When he's happy, he tells us more. That's how one of the ways to study with a Chinese master. But anyway, I put together all these different notes to help you understand, because there is a big language barrier. Sometimes when he speaks in Chinese, it makes perfect sense, but when it's in English, it's a little more confusing. Okay, so as far as questions, if you have questions, can you type them into the Q&A platform? And then when I have time towards the end of the class, I will go and answer them. Okay. All right, so next slide. Now, next to Tui Na, I think pulse diagnosis is probably the hardest to learn, because these two skills involve you actually feeling what the master is feeling, right? What the herbs, learning acupuncture, learning other styles is a little bit easier. At least it's not as, how do I put this? Because, with Tui Na, if you are learning Tui Na, if you're into that, when you're watching the teacher do the different movements, you sort of know what he's doing, but you don't really know because you're not the patient. You don't know how deep he's going, what direction he's going, how much force, et cetera. That's all something that is very subjective. So that's why it's always good if you're in a class for Tui Na or for pulse diagnosis, you become the demo patient. So to feel what the teacher is trying to feel, right? Like in pulse diagnosis, it's always good to be the demo patient. As he takes your pulse and he tells you what you have, you can take your own pulse and then see if what you feel matches what he feels. So that's why eventually, on your journey to become a good master pulse technician or diagnostician, you want to eventually, go to his clinic. It's like what do you call that? Pilgrimage to Tibet or to the temples. We pilgrimage ourselves to Dr. Chang's clinic when he's still practicing before he retires, to take pulses right next to him, right after he sees the patient, so you can get the most accurate reading. Maybe you have already, studied this for a couple years and you've discovered some new pulses that are not in the notes that we know of. It's a great way to ask him too. Okay, so there are many different pulse taking systems. I remember I studied with this one teacher in Taiwan, and he uses the Li Shizhen Pinhu Mai Xue, that school of pulse diagnosis. It's very, very different from this one. So I think if you want to learn, maybe one system at a time is good. Otherwise, it gets to be confusing. Okay, so now let's go in a little bit deeper here. The traditional TCM pulses, I looked over it, we have 29 pulses, but Dr. Chang has 68. That's a lot, right? So in the beginning, you think, oh my God, 68 pulses. It's kind of like the first time you met Master Tong and, oh my God, his Master Tong points, another 100, 200 points you have to remember. And the system is different from the TCM, system, something totally new. But don't worry, okay? When you're learning a new language, or when you're learning anything, there's always a framework. Focus on understanding the big picture first, okay? Don't worry about the details. It's kind of, I put it here. If you're looking at the word beautiful, okay, there are 50 synonyms for it. You can be alluring, cute, exquisite, like pretty, da-da-da-da-da. That's all beautiful. So what you need to remember is, okay, all that means beautiful, just basically not ugly, okay? So when you're learning pulses, same thing, okay? If it's a big pulse, is an excess condition. Don't worry about the intricate details of how he calls that big pulse. That's for later. For now, just know, okay, that's big pulse, excess. Okay, so same thing. So if you're learning pulse diagnosis, okay, if you're dealing with somebody with a fine, a weak or thready small pulse, in the beginning, probably you can't feel very much, right? Just to make it even more complicated for you, there's such a thing called the scatter pulse, which is blood stasis. So that is very similar to a fine pulse or a weak pulse or a deep pulse, small pulse. And then, you just stress yourself out. Oh, what is it? I don't really know. But you just at least know the big picture. That is not a deficient. That is not an excess pulse. So that big picture you need to know. Okay, going to Canada from Los Angeles, you go north. Going to Mexico, you have to go south. Okay, get the big picture first. So that's what I'm gonna do for you today. Get the big picture. Okay, don't stress out over the details. That is gonna come later, refinement and all that. You are going to get it eventually. Okay, next page. So I wrote a few things down that you can learn from Dr. Chang and few problems you can diagnose in the 寸关词 on the right side and on the left side. You cannot diagnose these using the TCM system. So if you're able right now to take the pulse of a patient, now Los Angeles County has a lot of COVID cases again. So when you're in your clinic, you are able actually to tell taking the right Chun pulse if it's a bacterial infection or a viral infection. So bacterial infection is going to be something that's floating, excess, forceful. And a viral infection is something that is deep. Okay, so we'll talk about that in a little bit later on today. But just to let you know, that's something that you can discern from just the right Chun alone. So this system is I think superb in this area where he has figured out and put in the puzzle, solve the puzzle in terms of what this means in terms of Western medicine, the specific pulse. So you can take a look at yourself, these different disorders that can be diagnosed. Okay, so on the left side, you can diagnose these problems. And most of the time when you're in his clinic, either as a patient or as an intern or in class, and he will diagnose you and tell you a lot of problems with you. Sometimes you'll feel like, oh gosh, I'm going to die. I have so many problems. And so don't feel alone. That is with every patient. There's always something wrong, because in the 20 years I've been learning from him, one time I asked him, Dr. Chang, is there such a thing as a normal pulse? And then he just laughed. He goes, no, everybody has some problem. And then 5 minutes later, he said, maybe the monk in the deep mountains have no problem and have a normal, has a normal pulse, but we don't get to go in there to take his pulse. Anyway, so there is not really anything that is really normal, because his conclusion of a normal pulse is not too small, not too big, not too thick, not too thin, not too forceful, not too weak. So at first, when he told me that answer, I was not very happy about that. Wow, that's not very normal. That's not telling me very much, But but today I feel the same way. What you're looking for in a pulse is something that's, pronounced, something that is unusual. But if you feel enough, if you feel many pulses, if you feel enough patients, then you will come to that conclusion too. Something that is not too excess, too deficient, etc., etc. Kind of like striking a balance. If your pulse is right in the middle, then yeah, the person is somewhat healthy, Okay, next slide. Okay, so like all geniuses, if you have learned from Dr. Chang, you know that he's not easy to understand sometimes and learn from. He has different terminologies, description for pulses. He names his pulse like sea turtle and sometimes convex roof. He has all these terminologies. But pretty much, again, when you get confused, just go back to the big picture, okay? Remember the framework and the big picture. Don't get too confused. And then sometimes he has the same pinyin name for the different formulas that he invents. Different ingredients for the same name. It's very confusing, but as long as I guess once you practice long enough, you kind of won't be so much of a stickler about what exactly is it. It's kind of like when I was learning acupuncture in school. Okay, well, this point, let's say, is 2 tun above the wrist crease. So Dr. Tan used to always joke about his German students saying that, they want to know exactly, is it 2 tun? Is it 2.1 tun? Exactly where is it? And years later, all the senior acupuncturists that we learn from, they will tell you that there is no point. It's in that general area. And then you need to palpate yourself to find where's the point, because these points move depending on the time of day and also depending on the state of the patient. So it is not 2.1 tun, 2.2 tun, 2. Whatever, And with the herb, same thing, sometimes he calls the herbal formula the same name, but he has different ingredients. But if you carefully examine the formula ingredients, you'll find the idea is the same. He's either trying to achieve the anti-inflammatory effect, or he's trying to move blood or whatever. He just uses different herbs. And he would sometimes tell you, when I ask him a question, it's up to my inspiration. Oh, I hate that when he says that, because there's no guideline for us students to know what is your inspiration, right? I mean, how do you come to that? But that's just him. He's just like that. So, when he's happy, I ask more questions. When he's not very happy, I leave him alone, basically. That's Dr. Chang. He's totally an artist. So learning from him can be a challenge. But, one good thing about him that I like a lot is that he doesn't hold back his knowledge. A lot of Chinese doctors that I have studied with, some of them, it's like pulling teeth to ask one question, take half a year for them to answer one question. And then the answer to that one question you could find in the textbook too. So those teachers, then I don't really study with them, because that's even harder than learning from Dr. Chang. And they're not necessarily better, well, I shouldn't say better. They know different, they have different specialties, let's put it that way. But then if they're that difficult to learn with, I don't feel like I have that much time to be in their clinic and to sweep the floor, or to do whatever, be errand boy or girl, because that's how it is to learn from a Chinese master. You have to do a lot of wax on, wax off, polish the car type of things, favors for the teacher, for them to take you. I mean, that's understandable. I mean, if you, think if you were one day, you have 40 years of experience and you're this great master in whatever technique you have. You don't want to take every student, right? Any and every student. Some students might ask very basic questions. Like the other day, I had a customer call and ask me, my patient is bleeding in the underwear. What formula should I use? So I thought, wow, this must be a student asking a question like this, right? Bleeding from the underwear, nothing else, no other information. Or somebody who would ask, what herbs do you take for stomach ache? Well, you know what I mean? So I had another teacher who told me, Dr. Peng, who specialized in cancer. I went to intern with him for 3 days, and he said, if you're serious about learning with me, I want you to finish reading these 5 classic books before you come back. I took a look at the 5 classic books he wanted me to read, and I thought, there's no way I can do that, because each of those books are like this thick, and they're all in classical Chinese, and it's very difficult. And I thought, okay, I better learn from somebody else, because he would look at me sometimes when I ask him. I remember, this is off topic, but it's interesting because I asked him about IVF babies one time. I asked him, so are IVF babies the same as regular babies? And then he looked at me, he said, of course not. What a stupid question you're asking, How can it be the same? And he just didn't answer. So, every Chinese teacher is different, but Dr. Chang's system, we have it pretty much all figured out. So today I'm going to give you a good overview. Okay, I'm going to make it very simple for you guys. And this is an intro class, okay? If you have any specific questions, you can find it in his different classes. I'm going to give you resources of where to go, where to find this information. Okay, so today's class is pretty much just 10 to 20% of his knowledge. All right. Okay, next. So before we start, I want you to forget what you know from school, if that's even possible. Especially, I'm talking about just the pulses, okay? Don't delete what you know about slippery pulse, weak pulse, thin pulse, and all that. And then I'll give you a foundation of how Dr. Chang's system is. And then so you can go from there yourself. You can come back and compare to the traditional system if you like and see what kind of differences there are. But in the beginning, it's better to just not confuse the two systems. It's a little bit different. Okay, next. All right, so let's go into the basics of the positions, okay? This is something that you should, if you don't know it already, you should know. I mean, the right 寸关词 and the left 寸关词 are these respective organs. Now, I think traditionally, we also say that the right side is the, especially the kidney position, is kidney yang, and the left side is kidney yin. But in Dr. Chang's system, the right side is the urinary function, and the left side is the reproductive function. Okay, so if you're gonna detect a infertility patient, what is going on, you need to go to the left, not the right side. Okay, and then everything else is pretty similar. You have the right tsun, you have the lung and large intestine. The guan position is the spleen and stomach, right? And the ci is the kidney, the urinary kidney. And then on the left side, you have the heart and small intestine, and then the liver and gallbladder, and then the kidney, the reproductive system on the ci position. So I think this is pretty easy. Everybody knows this. Let's go to the next slide. Okay, I'm gonna show you this. Sam got this really cool gadget. Is it on? It's on. Oh, okay. Let me switch the camera. I'll show you. So the finger position, okay. Traditionally, when we're taking pulses, the styloid process is where you put the guan position, right? You find your styloid process and you put your middle finger over it. That's the guan. But for Dr. Chang's system, you have to shift your finger slightly down a bit because that styloid process is the separation point between the cun and the guan. So this is very important because he's always said that if you don't get the position right, you won't make the right diagnosis, which is true. It's kind of like playing piano, right? If you don't get the keys right, your music is gonna be off a bit. Okay, so I want you guys all to take a look at your own hand now. Mark your own styloid process. That is the highest point. So let me show you on my hand here. Okay, so on my, can you guys see? So on my hand is pretty prominent. That is the styloid process, right? Highest point. So put a little mark there. So when I'm taking my own pulse, put a bigger mark. So I'm taking my own pulse. Oh shoot, this is kind of awkward. It's kind of like, yeah, so you get the idea, right? So cun and guan and ci. Okay, you got it? Everybody got it? So styloid process, okay? These are the positions I went over already. And then, okay, so one more thing is when you're taking the pulse, you want to take it from the outside. So you see the incorrect picture is you're going over the tendons. So then that is not recommended by Dr. Chang because what he's feeling is he's feeling the entire vessel, blood vessel. So you gotta be able to roll your fingers. When you are crossing the tendons, your hand is flat on the patient's, right? Patient's forearm, and then you cannot feel the pulse as easily, the entire shape of the pulse. So always come in from this angle, all right, from the outside. And then index finger is always the cun position, okay? You never taking pulse like this with the index finger on the ci. It's always this way. Okay, next is put your thumb on the sanjiao 4. So there's space to maneuver. So, okay, let me turn the camera again. Okay. So you're not taking the pulse like this because this dead space here will not allow you to maneuver the finger easily, right? So if your thumb is on sanjiao 4, you can fit an egg right here. That means then you can easily maneuver, right? You can use your fingertip if you have to, use the bed of the nail, or this way, or you can move around easier. You can move around like this and you can feel the entire vessel, right? But if it's not like this, it's like this, it's hard to move, right? You can try it on yourself. Okay, so the index finger is in front of the styloid, in front of the styloid process. So that's the first one, and then the middle finger, and then the last finger. And when you're taking pulses of the patient, you want to also remember the size of the patient relative to your size. So if I'm taking a pulse of a guy who is 6'5", I had to spread my fingers out a little bit more, right? Because he's so much taller. But if I'm taking a patient who is like 4'8", something like that, then I have to squeeze it in tighter because, you know, relatively speaking, they're smaller. So their 寸关词 will be smaller, the distance. Okay, next. All right, the patient's palm should be facing the side, not the ceiling. So I have a picture there for you. I don't know why, but I think it's just easier for you to take the pulse this way. Easier to feel the entire vessel. Okay, and then next, you want to start gentle. This is something that I did as a mistake when I was first learning from him. I remember, he would tell me to feel something, I would go in and grab it really deep, you know. So if you're feeling your own pulse, and then if you're seeing your finger turning white, then you're pressing too hard. You want to always just lay your fingers on the pulse and on the skin, and then just feel if you can feel anything on the skin level, gently first. Because a lot of times towards the end, when I was learning from him, I felt like a lot of pulses that he felt, it's something, how do you say this? Something that you pick up on your first try. So when you first put the hands on the put your fingers on the patient's pulse, whatever first feeling that you get, that's the answer. Many times, if you keep trying to go in and feel whatever it is, and then you get confused, you know, oh, I thought it was weak at first, but then how come it feels strong? You will get this feeling, but which one is right? You know, did I do it wrong in the beginning or what? One or two things. One is probably because your position was wrong. So that's why you're feeling weak and sometimes strong the next time you feel it. And two is because you're too nervous and you're just trying too hard to figure it out. It's very difficult in that sense, because then you're not really picking up what the patient is exhibiting, rather than you I guess, how do you put this? Like your energy is all in your brains more than on your fingers trying to feel. You're trying to logic it out what you're feeling. So in that case, it's really hard to feel the pulse. Okay, so in the beginning, just put your hand gently there and see if you feel anything, and then go slightly in. And always, you know, Dr. Chen always says, if you don't feel it, take your hands off, come back again, because, you know, patient's heartbeat is going on, and then you can try again and see how you feel. But then you might encounter what I just told you. You feel something totally different than what you felt at first, and that's normal, okay? Okay, next one. Okay, so he says, take the pulse with the bed of the fingers. Don't take it with the tip of the fingers. And that is just basically to have more surface area so they can feel the entire vessel of the patient. Okay? Okay, so that is pretty much the basics of taking pulses, where your finger should be. And if you look through your lecture notes, I put down this important, right? On the top right-hand corner, right here. If you see it important next to a slide, that means that slide is important. When you go back to review the notes, you want to review those slides. Those are more important than the other ones, because it gives you the overall big picture and the big framework. Okay, so really, when it comes down to it, what Dr. Chang's system is, you just have to figure these three things out. One is the jump, one is the shape, and one is the level. Just these three things. And if you want to narrow it down even more, it's really just the jump and the shape, because the level is significant in some cases, but not in others. In some positions, not in other positions. So now let's spend a little bit of time on the jump, okay? Oops, go back. So jump pretty much is the pulsation aspect of what makes up a pulse. It's very much just the strength. So we're dealing with either strong or weak. That's it. So get it into your brain that it's really just a strong pulse or a weak pulse. You figure that out, then you can figure out if the patient is more on the strong side or on the weak side, or too much fire or deficiency. Okay, so that's the one big picture, strong or weak. That's the jump. 2 is the shape. So you want to figure out what the structural aspect of what makes up that pulse. Is it a straight pulse? Is it a convex pulse? Is it a concave pulse? Okay, so what is that? What does that mean? So what is a straight pulse? That is pretty straightforward, right? A straight pulse is just like a straight pulse. And a convex pulse is something that you can feel like a bulge. I'll show you a picture later. Concave pulse is when you put your finger on the pulse, it just feels like, nothing's there, it sinks in. Kind of like somebody's fat belly. Put your finger there, it sinks in, kind of like that. Nothing down there to hold it. There's no vessel, no shape, nothing. It's like a concave. But it really is deficiency of that pulse. But you can still feel the border a bit. That is descriptive. You might not feel that in the clinic, but if you feel like a concave pulse, he specifically talks about this concave pulse more in the left guan than any other position. So if you see like a weak pulse in the left guan, you can pretty much go towards a concave pulse, and come to the conclusion of concave pulse. Okay, so this is what makes up a pulse: the strength, the shape, and also the level. The level is at the depth of which the pulse is felt. Okay, sometimes it's in the superficial level, sometimes in the mid level, sometimes it's in the deep level. Every pulse has its own normal level that it should be in. And if it's not in its own normal level, it's disease, something is wrong. So that is something that you can learn more of as we get into each position. Okay, but if you take away that level and then just focus on the jump and the shape, you'll be fine. By the end of today, if you just get these 2 ideas, then you're good. Okay. So next. So here I further broke it down for you. Okay, the jump is defined as the force of the pulse rebounding on your finger. So you want to determine the following. Now, if you have a super forceful pulse, then you have a lot of excess heat or you have fire. If it's just forceful, then it's heat. If it's normal, like all 3 positions feel pretty much the same. There's not one pulse that is higher than the other, and it looks pretty congruent with the patient, then that's pretty normal. It's not too strong, not too weak, And if it feels weak, there's deficiency. And if you don't feel anything there, then that patient is very deficient. Okay, this is the general guideline. There are some exceptions. There are some pulses, like I was telling you earlier about the scatter pulse, right? Scatter pulse, that is not deficiency, that is blood stasis. Feels very similar to this, but then that's something for you to feel and figure out yourself later. So pretty much that's the jump. Okay, the shape of the vessel. Now, you can further divide this into these 4 categories, okay? So what you want to feel for each position is if the pulse is thick or thin, and if it's straight or if it's or curved. Let's put it that way. Concave or convex, they're curved pulses, and straight pulse is just a straight pulse, and they have different definitions. So just to give you an overview of the difference between straight and curved pulses, you can write this down on your notes. Straight just means there's a lot of fire, usually, or a lot of coldness. It hasn't changed the structure of the body, or the structure of the body, the anatomy is still okay. So that's why the vessel is still straight. However, if you're feeling the convex pulse, that means something is swollen in the body. Either the soft tissue is swollen, or you have some sort of nodule growth, or you have some sort of cyst growth, or you have some mass or tumor or whatever it is that is presenting in the pulses. So in that position, if you feel a bump or something convex, something is growing in that area or something is swollen in that area, like a hernia. Many times you'll feel that in between pulses, in between Cun or Guan or Ci, in the middle, you can feel it feels like a little bump. Those are usually hernias. And if you feel like a bump in the right Cun, that might be some sort of polyp or some sort of colitis or something swollen in the large intestine. Okay, we will go over that. You can take a look at the chart that I put together for you later. But in essence, just remember this, okay? It's either thick and straight, thin or straight, thick and convex, or thick and curved, or thin or curved. So there's no other type of possibility. These are the possible shapes. Okay, other shapes that are more complicated, we won't discuss, like the ones like the step pulse or like the scatter pulse. We won't talk about it here, but the big picture is this. Most of the pulses will fall into these 4 categories. Okay, next one. Okay, so now if you think about it, if thickness means expansion, can you type in the chat room and let me know what you think would cause the vessel to expand? What do you think? Out of the, the 6 evils that we know, what do we have? We have wind, cold, heat, dampness, dryness, and summer heat, right? What could cause the vessel to expand? Heat, damp, heat, damp, heat, damp, heat. Yeah, very good. But if you have to just pick one, would it be damp or heat, you think? Which one could cause more expansion? Damp, heat, 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 damp, heat. Yeah, the answer is heat. It's kind of like when you get angry, your vessel expands, Dampness, I see your logic. Some of you put down dampness. It's probably because you're thinking the dampness causes blockage, right? And it makes the vessel expand. But it doesn't do that. The pulse for dampness in his system is a deep pulse. Every fat patient or obese patient or somebody with a lot of water retention all have a deep pulse. They will not show a superficial thick pulse that is easily palpable. Okay, now next, constriction. What makes the pulse constrict, you think? Let me read you again the 6 evils. We have wind, cold, heat, damp, dryness, and summer heat. Oh, very good. Cold. Yeah, oh my God, you guys are all gonna do so good. It took me years to learn this stuff. Maybe you'll get it in half a year. Congratulations. Yeah, it's just easy, right? If you think about it, if you have a a pulse that is constricting and thick like a guitar string, very wiry, very thin, you're dealing with constriction. And what causes that constriction, right? Cold is the first one that you can think of. And then probably next one is liver qi stagnation, right? That causes constriction. But pretty much heat and cold, when you're in a hot weather, your vessel expand, like global warming right now. Los Angeles is so hot. And then, yeah, thin pulse, in somewhere where it's snowing, your vessels constrict. So that's exactly what it is. If you're dealing with a thick pulse, you just think towards heat. If you're dealing with a thin pulse, think towards cold. Then you're in the general right direction, okay? And then from there on, you want to figure out, next is what is the jump, right? Because we have figured out the shape. Let's go to the next picture here. All right, take a look at this. Hey, don't jump ahead. Deficient blood later, okay? Well, let's look at the big picture first. Going north, going to Canada first. Now, if you're dealing with a thick and forceful pulse, which he calls a big pulse, is it clear to everyone that is an excess heat condition? This is not a deficient heat, right? It's a totally big picture of a excess heat patient. It's thick and it's forceful, right? Thick is the shape, forceful is the jump. So for every pulse, every patient, every position, you want to always go back to yourself and think, what is the shape? What is the jump? And then if you want to figure out the level, okay? So Dr. Tan has the acupuncture 1, 2, 3, remember? In the very beginning when he was teaching, after dinner, we were talking about it and I suggested to him, I can't remember it was me or John, why don't you do acupuncture 1, 2, 3, make it simple, 3 steps. And then in pulse diagnosis, you can do the same too. It's pulse diagnosis 1, 2, 3. 1 is figure out the shape. 1 is figure out the jump. And then the last figure out the level. So if you go back to this every time, you will not get confused. Later on, you're going to have confusing questions, but if you can always come back to this, you won't be confused. Okay, I'll tell you why when we finish this section. Now, next, we have thin and weak, which is what he calls a small pulse, right? So does that everyone understand that's a deficiency? Yeah? Oh, sorry, I should have made this. The thin plus forceful should be a different line. Let's see if I can correct this. Yeah, like that. Yeah. Okay, so Sam, how do I share this screen again? Just
yes, go tap it.
oh, do this?
Tap.
Tap.
Oh, no, don't have it. Turn it
I took it off. Okay, so does that make sense to everybody? The thin and weak equals deficiency, right? When the shape is small, the pulse is low, then that's just deficiency, no question. There's no excess picture here at all. I think that should be pretty self-explanatory, the first two at least, right? Now, the next one, thin and forceful. Have you ever encountered that kind of pulse? It feels very tight, like a guitar string. So if it's thin, that means there's some sort of constriction. And if it's forceful, that means there's coldness. Okay, that's what that means. And this is especially true if you find it in the left Chun position. If you find this pulse in the left Chun position, you know that the heart has coldness, and heart is the organ of the fire, right? And in the fire element, the worst thing you can do is to have cold in there. So these are the people who have angina. So if you feel that kind of pulse, you would ask them, oh, do you have chest pain? You might have angina pectoris if you feel this pulse. And then the last one, thick plus weak. That's what Dr. Chang calls a scatter pulse. And scatter pulse means stagnation, or more specifically, blood stagnation. So this is a pulse that is harder for beginners because it's hard to distinguish this from just a thin pulse or just a weak pulse or just a deep pulse. So my suggestion for this is when you feel the pulse and you feel like, oh, it feels kind of deep. I cannot really feel anything. I don't know what this is. Okay, then maybe it's scattered, but maybe not, okay? And you would double check to see if scatter means blood stagnation, right? So this patient is also going to have other blood stasis signs. Very obvious when they're sitting there, just look at their lips. If it looks kind of purplish, right? And then look at the arms, if it kind of looks dark in the crease. And then look at their tongue, if it looks purplish, then you know, yeah, whatever pulse you were feeling, it's not just thin or weak, it's a scatter pulse. So that will help you to determine what is a scatter pulse, because that pulse, I think it's hard for people to feel in the beginning. And thank goodness we can, ask questions and look at other signs, right? Not just purely rely on pulse diagnosis. So these are the 4 big summaries of what pulses you should be looking for. Every pulse almost could be categorized into these 4 categories. So as long as when you're taking the pulse tomorrow, remember the pulse diagnosis 1, 2, 3. What is the shape? Is it thick or thin? Is it curved or straight? And then next, number 2, what is the jump? Is it strong or weak? Then you can figure out the big picture, which of these 4 categories does the patient belong to? Okay. Now, let's go to the next one. Okay. Now I'm going to come back to these questions later after we finish talking about it. Let's go to page 6 of your handout, okay? Oh, wait, no, sorry. My handout is different than yours. I printed 6 slides to a page. So I don't know what page this is, but just keep going. Skip the questions. Let's come back to them later. let's talk about the shapes first. I want you to understand the difference between the thick and thin and strong and weak first before we go to the questions. Now, here's a good example, right? If you're looking at, look at this. Look at how the vessel can bulge like this. So if it's bulging in an aneurysm like this somewhere in your body, it's also reflecting in your pulse too. That's exactly what it feels like in your pulse. So if you are dealing with that, if you feel that, why don't you guys feel your own pulse while we're, while you're listening to me? I mean, is there anywhere, do you feel your pulse to be straight? Is it curved? Is it bulging like this at a position or in between positions? If you feel that, that means there's some sort of swelling, right? Your structure, either you have inflammation and swelling, or you have some sort of mass growing, obstruction, or stagnation. Okay, if you want to know the specific definitions or specific terminologies of the different types of bulging pulses, you can go to his Pulse Synergy Part 2 class. He has 3 classes. Those are the 3 classes that gives you the basics of all his pulse diagnosis. Today's class is kind of like a summary of these 3 classes. So let's go to the next slide. Okay, so can you see the 3D view? This one, the pulse is convex. And when you're looking at the convex pulse, this is a shape, right? Convex pulse is a shape. So if when you're feeling the jump of the pulse, if it feels forceful, that means the condition is more acute. There's more inflammation, there's more blockage, and there's more pain. So it's an acute state. You have to help them with that, reducing that bulging pulse or that convex pulse so they'll feel better. And then next is if that bulge, okay, now feel your own pulse. If you feel a bulge, press down on it. If it feels soft, that means it goes away when you push deeper. Then that means it's usually a temporary condition. It's not very severe. Perhaps it's just gas or chi stagnation. Okay, nothing to be more concerned about. It will most likely go away itself if your diet and lifestyle, is changed. But if you're feeling something that is hard, meaning you push down on it and it's still there and you cannot push it away, okay, then that's when you should be a little bit more concerned because that means there's something solid. Okay, so he calls it like the bean pulse, the turtle pulse, rainbow pulse, all that. It's just all convex pulses. And the reason he calls it that is because he's an artist, he's trying to find a terminology that best correlates to that pulse because some convex pulses are bigger than others. So he has to give it a different name. And later I'll give you a picture that sums up all of them and then the sizes. I remember the day when we were trying to figure out like what size is exactly a bean pulse, like he would say, oh, you find a bean pulse in between the 2 pulses. What size is a bean pulse? What size is a rainbow pulse? That was a very interesting conversation. He had to finally give us some definite answer for reference. And that will be in the chart that's coming up that I'll share with you in a bit. Okay, so all of these, it just pretty much means there's something growing or something swollen in the body. And the harder it is, the harder the pulse. The softer it is, the softer the pulse and the less severe. Okay, so this shape is the shape of each position. Okay, we're not talking about the entire 寸关词, the shape of the vessel. We're talking about the shape of the vessel in each position or in between positions. Okay. Anything else I want to talk about here? Okay, no, next. Concave pulses. Okay, these are the pulses that dips down. Okay. He did that picture before. Okay, on top here you see the 3 springs, right? He always would describe like the pulses feel like you're playing the trumpet and the trumpet has springs underneath. So that rebound pressure, what you're feeling is the strength of the spring, right? Which is the jump of the force. So the concave pulse feels like the spring is broken. That's what that feels like. So if you're feeling your pulse, and then you find the pulse in the deep level, and you're not sure if it's a deep pulse or a weak pulse or a thin pulse, it could likely be a concave pulse. And just remember that concave pulses are usually found on the right or left guan positions. So you're not likely to find a concave pulse in the Chun or the Ci position. In the Chun or the Ci position, he just calls it a weak pulse or small pulse. Small pulse is a thin and weak pulse. Thin is the shape, weak is the jump. So only when it's in the guan position, he calls it a concave. So I guess technically you could also say that's just the weak pulse. Okay. All right. So there are a lot of meanings that we will go over what that means, the concave pulse, but in general, it's more deficient than excess, right? Because it sinks in and it's deep and it's weak. So that I hope makes sense to all of you. So whatever is bulged up is more excess. Whatever is concave is more deficiency. Okay, level. Now, level is the level in which you feel the pulse. So generally speaking, superficial pulse is more of an exterior condition, and deep pulse is more of an interior or chronic condition, generally speaking, okay? But superficial pulse does not always mean exterior invasion. We learned that in school. I learned that in school. Oh, superficial pulse means, you know, you catch a wind cold or a wind heat. But when I asked Dr. Chang that, he says, no, that doesn't necessarily have to be true, because if you take the pulse of a patient with hypertension or hyperthyroidism or somebody with excess heat, you can still feel their pulse on the superficial level, right? That doesn't mean that they have wind cold or wind heat. That got me thinking. So my conclusion of that was superficial pulse, or the pulse when you can feel it, right, when you put your finger on it. If it's on the right Chun, which is the lung position, then more likely that you're dealing with a respiratory infection, wind heat or wind cold. Any other position doesn't necessarily mean that there is. But I suppose the answer is very easy, because when they have a cold, you can tell, right? They're either coughing, have a sore throat, or they look like they have a cold or flu. Then you don't really even need to know superficial pulse or not. So anyway, so going with the level, I didn't put this down. So will you write this down on your notes? That generally speaking, Chun Guan Ci, the level should be, Chun should be more superficial, Guan should be mid-level, and Ci should be a little more on the deep level. So if you're finding the Chun position in the very deep level, something's wrong. Or if you're finding the Ci position in the superficial level, something's wrong. Okay, they should be in their home position. That's what we call a normal pulse, in their respective home position. Chun is always more superficial, Guan is mid-level, and Ci is deep level. And that has to do with the anatomy of the hand too. If you look at the anatomy, you know, the Chun position is just higher, right? So naturally it's like that. All right. Okay, next is, in terms of level, I just want to let you know that superficial equals dryness. So that you can, to help you remember that, you can remember that when you have dryness, you usually have heat. Right? It's not very often that dryness comes with cold. So when dryness has heat, then the pulse will be more superficial because there's heat involved. And dampness is like water, right? Water, you can go down deep in the ocean. So you can remember that deep pulse equals dampness. So if you're dealing, so with this, let me ask you a question. Now, if it's damp heat, what are you feeling? What type of pulse could it be? Damp heat. So damp, you're dealing with deep, right? Heat, what pulse is heat? Can you type in the chat room for me? Damp heat is deep and what? Is it deep and forceful or deep and weak? Yeah, good. Yeah, pretty much deep and forceful. Hey, the person who says slippery, Evan, You still haven't forgotten what you learned from school, huh? Slippery is dampness back in school, but not here. Slippery means mental disorders in Dr. Chang's pulse synergy. Sorry, I didn't mean to call you out, but I was just thinking, that's what I thought too in the very beginning. Slippery pulse, like rolling pearls, but okay, it's just a different definition, different terminology. All right, next one, not superficial. Okay, if you're dealing with dry heat, what's the pulse? Somebody with a skin disease, dry heat is your diagnosis. What's the pulse? Superficial and what? Yeah, superficial and forceful. So it's pretty much like that. Very easy. Just figure out the shape, the jump, and the level, and you got like 50% of it down. Okay. Very good. Okay. Now let's go back to the questions now. I want to go back to the questions. Make sure you understood what I was saying. Oh no, Sam, the screen went blank. Why? Did I push something? Oh, maybe. I think I might have pushed the keyboard.
Oh, yeah.
Can you guys hear me? Okay, sorry, my screen went blank. I can't even see. Okay, you know what? Then why don't we take a break? I'll Sam fix this. Let's take a break for 10 minutes and then come back. I'll ask you those questions. Okay, thank you.
Recording stopped. Recording in progress.
Ready? Ready, everyone? Okay. Let's come back. And before we get on to the questions, somebody asked about what is in-between pulse. Okay. Chun, there are three positions, right? Chun, guan, and ci. So in between, well, Chun, guan, and ci, other than representing each organ, the organs that are in the position, they also mean upper, middle, and lower jiao. So specifically when we're talking about the convex pulses or something, there's a mass or some sort of swelling or whatever, it could happen in between pulses. So what I mean is if your finger is here, right? Cun, guan, ci. Now, in between pulses, I mean like in between cun and guan. So it's right on the styloid process, you feel some sort of a bump. That means that stagnation or hernia is right in between the upper and middle jiao, somewhere over here. There's some sort of swelling or some sort of mass or some cyst. If it's between guan and ci, it's indicating the swelling or the mass. It's between the middle and the lower jiao. And if the convex pulse or the bulge is right on the position of cun, guan, and ci, or ci, that means it's either in the upper, middle, or lower jiao. Okay, is that clear? Okay, so let's go to these questions I have for you. These are very common questions that you will have if you are new to this. Now, can you guys type in the chat room? Is a thin pulse the same as a weak pulse? Yes or no? No, no, yes, yes, no, thank you. No problem. No, no, no. No, 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 yes. Okay, let me ask again. Is the pulse thin and weak the same? Now let's go back to that pulse 1, 2, 3. What is number 1? Figure out what shape it is. Number 2, what jump it is. So if you're looking at a thin pulse, is that a jump or is that a shape? Please type in the chat room for me. Is thin pulse a shape or a jump? Shape, right? Is weak pulse a shape or a jump? Jump. Great. Perfect. So let me ask you that question again. Is a thin pulse the same as a weak pulse? No, right? One is describing the shape of the pulse, the other one, the jump of the pulse. So you don't really know what the patient has yet until you couple that thin pulse with something or you couple that weak pulse with something, right? It's either weak and something else, thin with something else, right? But weak and thin pulse are not the same, okay? Not the same. Good. Next. Now, is a thick pulse the same as a forceful pulse? Not a trick question, okay? Come on, you guys. Yes or no? Okay, good, good, good. Okay, yes, no, meaning yes, you're right. The answer is no. Thick pulse, that's a shape. Forceful pulse, that's a jump. So that's like talking apples and oranges. They're not the same, okay? Because thick can be forceful, thick can also be thin, and forceful can be thick and forceful can be thin, right? So it depends on what it is. The diagnosis is different. So those two are not the same. Good job. Okay, next. Now, here we go. Is deep pulse the same as a weak pulse? Yes or no? No, 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 no. Oh, good. Very good. It's different, right? Because pulse 1, 2, 3. 1 is shape. 2 is you figure out the jump. 3 is you figure out the level. We are dealing with the level here. So deep pulse is just a deep pulse. Deep pulse just tells us, okay, there's some dampness there and it's an interior problem, but it doesn't tell us what else, right? It could be deep and strong, could be deep and weak, correct? Totally different herbs, totally different diagnosis. Now, how about a weak pulse? Right? It could be weak and thick, weak and right, weak and thin. It could be weak and deep, weak. Can it be weak and superficial? Not really. Not that combination doesn't usually happen very much. But these two definitely are not the same either. Okay, good. You are getting the hang of it. As long as you're clear about the shape, the jump, then you won't get confused. As you're studying this, sometimes you confuse yourself back to, going back to your TCM terminology. That's when it gets really confusing. Okay, next, is a forceful pulse the same as a superficial pulse? Yes or no? No, 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 no. Very good. Excellent. Good job. You guys are going to get this really fast. All right. So, right? Forceful is a jump and superficial is a level. Now, let me ask you a secondary question to this. Are forceful jumps or forceful pulses usually superficial or not? What do you think? Yes, yes, no, yes, 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 no, no. Yeah, I can see why you think yes and why you would think no, because it could be forceful, right? And superficial. That means there's a lot of dryness if it's forceful and superficial, right? But if it's forceful and deep, you're dealing with damp heat, forceful and deep, right? In the third level, you can still feel that it's forceful and it's deep, right? In the deep level, you feel it, as opposed to when you first lay your finger on the skin. So those two means totally different things, right? You wouldn't use something that herbs like huanglian to let drains, right, damp heat for something that is a dry heat condition. And you wouldn't use something like zimu, right, that moistens and also clears heat for a condition that is like a damp heat condition, like a UTI. So this pulse, specifically, if you see it on like the right, right, a superficial forceful pulse versus a deep pulse, deep forceful pulse, they mean different things. Okay, so let's go to the next one. Oh, okay, you guys already answered all the questions correctly. Let's go to the next section, which are the other pulses. This is just a very, very general overview of how do you categorize all the pulses into the big picture. Okay, so this one, let's go to this one. Can you find this on your lecture notes? This is the Sao In elbow pulse, Sao In pulse. So he checks the pulse up here. This is what he calls the Sao In elbow pulse for hidden hypertension. And what is that? Okay, so in Dr. Chang's clinic, the flow of the clinic goes like this. The patient goes in, they fill out their patient form, they wait in the waiting room. The front desk staff takes the patient to a room to take their blood pressure and heart rate first. So the girls will write down on the patient chart what the blood pressure and the heart rates are. And then from there on, they go into Dr. Chang's clinic intake room. So Dr. Chang will feel the pulse. Now, if this intake form shows that the patient has high blood pressure and Dr. Chang is feeling the pulse, and the pulse feels weak and feels small and deep, but the blood pressure is high, that is when he will go to this pulse here to check the elbow and to check to see if there's any kind of pulse here. And usually in such a case, you will find a very thick and strong forceful pulse here. And what that means is this patient has a lot of stagnation. So the blood flow from the heart coming out to the arm is still very strong here, but it's blocked. The peripheral circulation is so bad that it feels weak. However, the patient has high blood pressure. So in that case, what you want to be careful, this is only when he wants to, this is only used when he needs to be careful with herbs, because if you don't take the blood pressure, you just take the pulse and you feel something weak, you would think, oh, deficiency, right? And you give him some tonics. Well, that might worsen his high blood pressure condition, right? Because you're giving tonics when maybe you shouldn't. So this is the time when he would check the Shaoyin elbow pulse, just to confirm that the pulse is not deficient by nature or by constitution, but rather is blocked. Okay, so he takes the the Shaoyin pulse when the elbow is straight, and when it's bent, you can feel it too, but when it's straight, you can feel it easier. And it's on both sides. You can feel it on both sides. But you know, he is always sitting to the left of the patient in his clinic. So he usually just feels the left hand, the left arm of the patient. Okay, so the brachial pulse is right here. Let's see. Let me see if I can turn on the camera. Okay, so right here. So he does this, uses his thumb. And then you can try to see if you can feel it yourself. If it feels hard and strong and thick, then that's not a good thing. Cool, so that's called a Shaoyin elbow pulse. Okay, next is you have the heart 7. Oh, somebody asked, you have a pulse on your thumb though. Yes, you do have a pulse on your thumb, but then you can distinctively feel that very thick pulse when you feel it. On some people, you won't feel a thing. So if they have it, you will feel it. Okay, next one is the heart 7. Heart 7 pulse. So let me go back to my camera here. Okay, so here he's taking the pulses of this side on the heart channel. Here. Okay, so that's pretty easy. Something that he discovered recently in the last few years, I think. So now you can try to feel it on yourself, okay? Feel your right side, right hand. Feel the entire 寸关词 here, you know. This one, he didn't say specifically that your index finger has to be on, you know, close to the wrist or not. As long as you feel a pulse or not is what's important. He didn't specify how you should put your fingers, but do you guys feel the right side? If the right side, if you feel something, that is telling you something about your testosterone. So if you're a guy, try to feel this side. See if you feel anything. If you don't feel anything, okay. If you feel something, I'll tell you what it is in a second. And then if you're a girl, you'll feel on the left side for the estrogen level. Okay. So he says, other than the hormones, it also represents the thyroid function. So let's take a look at what it means. So a man with excess right side heart 7 pulse has excess libido. So that means there's a lot of testosterone, there's a lot of kidney yang. So if you have too much pulse, you can feel too much pulse, then, you know, that's basically kidney fire if it's too much. But if it's a pretty healthy amount, I mean, it feels like if you feel it, but it's not that strong, then that's okay. But if you don't feel it, if it's weak, that means there's kidney yang deficiency, okay, for men. Now, going over here to the left, you have the estrogen, right? So for women, if there is an excess pulse here, that means if you feel, oh, it's a strong pulse on the left side for women, then this patient has excess libido. There's just too much kidney yang for the girl. So if it's weak, that means there's kidney yang deficiency, right? Weak libido. All right, so that's pretty clear, self-explanatory. Now, if a man has an excess left side heart 7 pulse, what do you think that means? Can you type in the chat room what you think that means? So to me, that means the man has a lot of estrogen, right? You're talking about an excess on the left side. So if a man has too much estrogen, then whatever the symptoms may be, he will manifest that. But usually these men are going to be I guess, more womanly, or I don't know how you describe it, but the way Dr. Chang described it is they're more niang, which means they're more like women. And similarly, if a woman has an excess pulse on the right side, then this means they have more testosterone. And he says that usually they are the ones who are more bossy. They act more like a man, and they're more like a man because they have more testosterone. Let's just put it that way. I don't know how else to describe it. Okay, so yeah, so a woman with a stronger right hand is going to be more masculine, and then the man with the stronger left will be more feminine. So that's pretty much how you conclude it. When does he use this in the clinic? I'm not sure. That's a good question. Sometimes he takes the pulse, sometimes he doesn't. He doesn't do it on everybody. I don't know when he would do that. Probably when he's dealing with infertility or something like that, he would take that pulse. Or dealing with the reproductive function or treating sexual disorders, he will take that pulse. Okay, let's keep going. All right. So these extra pulses, you don't really need to know, okay? Just know that there is such a thing, but you don't really need to know it yet because this is like all extra information. What I want you to still focus on are just mainly the 寸关词. Trying to figure that out is already difficult. Okay, so he also has this 8 extra meridian pulses, you know, what's listed here. He could spend 2 hours talking about just this and describing these, but pretty much they just all mean thick or thin, strong or weak. You can break them all down like that. Okay, so don't worry about it too much. But just know there's such a thing. But it's also a terminology only. You know, you could, like for example, the Ren pulse. Ren pulse is something that is thin, wiry, long, and tight. So if you don't know that it's called a Ren pulse, and that is also a pulse that appears on the Ci position and beyond, meaning proximal, on the Ci and proximal to it. If you feel a thin, wiry, long pulse, that's called a Ren pulse. Okay, and it's also close to the bone. But if you don't know that, if you can describe that it's a thin, long, wiry pulse, then that's also good enough. You don't need to know that it's a Ren pulse because they all of these names, they all boil down to the same thing, whatever the jump and the shape is, okay? Okay, actually, let me go back and tell you a little bit more about this. Some of these 8 extra meridian pulses, the reason they are called 8 extra meridian is because they're not in the regular 寸关词. Okay, when a disease has manifested beyond the regular organs, they'll go into the extraordinary vessels. So the extraordinary vessels are usually proximal or distal to the pulses. So it's gonna be proximal. Some pulses like the Du and the Ren and the Yin Qiao, you know, are over here. And the Yang Wei, Yang Qiao, Yin Wei are up here. So they point to the middle finger, the index finger, and the thumb finger. These are the pulses. Pretty much they, how do you call it? The normal position cannot contain these pulses anymore. So the disease spills over to the extra meridian. So you will see them up here or down here. So that's why the extra meridians. Okay, let's go to the next. Okay, so and then this is another one. He has been talking about this advanced Bagua pulse for a long time, but only a little bit. There's no complete system yet. I think it's still in the working progress. When he feels like it, he will feel this pulse on the patient. But different levels have different feelings. And what he's doing is, if you look at the lecture notes that I put down, so he would feel the gua of each position. So in this case that I put down here, if it feels like this gua here, it's all empty, empty, empty in all 3 positions, superficial, mid, and deep position, all feels empty. That is a tie-in, spling pulse. So if you feel that in whatever position, that just means that that organ has dampness. But I don't see him do this very often, and I don't see him doing this on all the pulses. So my conclusion is that he's still working it out and trying to figure it out. And he's still discovering, always discovering something new in the clinic as you see more patients. So this system is not completely solid yet, but I just wanted to let you know that there is such a thing, when you feel the gua, and then what you're feeling in the gua is you're feeling the 3 different levels, whether they're strong or weak. Okay. Let's go to the next one. All right. So this here, I put an important next to the slide. So this I took out from the Pulsenergy Class 2 lecture notes. It summarizes all his 69 or 67 pulses, the different names. So if you take a look at it, take a look at the first one, being pulse. So being pulse, what we did was on the left first column, we put down the name of the pulse in alphabetical order. The second column, we categorize it in terms of, when he says a being pulse, is it a shape? Is it a jump? Is it a level? So we put that there. So you can see that a being pulse is a shape, and it's a convex shape. And if you want to read more about it, it's on page 3. I didn't put the whole lecture notes here. I just wanted to give you an overview of what possible pulses you can find in his system, and also what they are, if they are a shape or a jump. It's very overwhelming to look at the notes, because I think if you're a beginner, you look at that, you will probably give up, because this is too much and too hard. If you don't listen to the lecture along with the lecture notes, it's too much. So for now, all you have to do is look at this, and if you're curious and want to go back to the definition of, what he says of particular pulses, you can come here first, at least just to know the shape, the jump, and then what it means, you can figure out that later. Okay. Next page. Lots of pulses. Yes. Okay. Can you guys see this? Do I need to zoom out? You can see this pretty well, right? So let me go over this with you. Took a long time to go to produce this chart. So now, if you look at the shape, straight, wiry pulses, the comparison of the diameter of the straight pulses. Okay, so let me see if I can have annotate. Mouse. Okay, can you see my mouse moving on the screen? Yes? Or no? Yes, the mouse? Okay. So if you look at the chart here, let me just tell you how we divide this out, okay? So on the left, this is when we asked Dr. Chang, how small is a small pulse, or a roof? How thin is a, basically we want to know the size, because when you're taking the pulse, you have no idea when he's throwing 5 or 6 different pulses at you, right? So blade here is the thinnest of all straight pulses. So that is approximately 0.1 millimeters. Okay, we were really very German when we were asking him this. So give us an exact size. But relatively speaking, okay, we were just trying to get him to tell us, in comparison of all the straight pulses, which one, or the wiry pulses, which one is the thinnest, the gradient, thinnest to the thickest. So here you go. Blade is the thinnest, roof is the second, and then Ren, in-chow pulse, which is also known as a guitar string or steel wire pulse. So if you're dealing with a wiry pulse, when you feel a wiry pulse, it's right around here, 1.25 millimeters, about a Ren, or it's also called a Ren or in-chow pulse. That is a guitar string or a wiry pulse. Normal pulse is about 2.5 millimeters. And then here on the right side of the spectrum, you have the thick pulses. You have the Cong pulse or the Du pulse or the Taiyang pulse. And here, 5 millimeter, big Shaoyang pulse. So don't worry about all these terminology for now, okay? You just focus on knowing that the thick and thin pulses could range from 0.1 millimeter all the way to 5 millimeter. So the thicker it is, the more heat, usually, and the thinner it is, the more cold. Just remember that. Later, as you study more, you can go into, okay, well, how thick is exactly a blade pulse or a roof pulse? And one thing is very encouraging is great that we have body memories, you know, because when you feel a pulse, once you feel a pulse and you know what that pulse is, your body will not forget. Next time you feel it, it will remember for you. You don't have to remember it cerebrally. You know, the body will know, that's this, that's that. So that's a great thing about body memory. So, but then before you can have that, you need to know, like, you know, on the spectrum of thick and thin, where those are and what they mean. Okay. So then now going down here, thin and straight pulses from 1 tightest to 5 least taut. So tightest to, I guess, loosest, if you will. So here we wrote it down, you know, blade is about 0.1 millimeters and the tightness is 1. And then all the way coming down to here, right? To the very bottom, the brachial pulse. The brachial pulse is this one down here. That is greater than 5 millimeter. And the tautest is, the tightness sensation is a 6. Thickest. So this is the thickest. And this is the thinnest. The blade pulse is the thinnest. Brachial pulse is the thickest. Brachial pulse is only found here. The blade pulse is something he talks about only for the left guan. And if you find a very thin, very tight, almost like a blade cutting your hand, that is a very dangerous pulse for the liver. It just pretty much means the liver cirrhosis or the liver is going to fail. You know, it's a very dangerous pulse. And I think that's the case for probably all the organs, but the ones I remember are this one for the left guan and then the left tun, right? The pulse within a pulse, which is like a very tight guitar string pulse on the right tun, which means there's coldness, extreme coldness in the heart. And extreme coldness in the heart is just equals angina. There's also bad news for the organ. So anytime you have such a thin and tight pulse, that means something in the vessels in the organs are constricting so much that it's probably not pushing enough blood into the organ, so the organ is going to fail, you know. So that's what that means. The blade pulse, the roof pulse is also the same. It's also the same thing. Roof is, he's not talking about the flat roof, okay? He's talking about the roof that's like this, and on the top it's very sharp, you know, this area of the roof. So roof is kind of like blade, but it's not as sharp as the blade, not as thin as the blade, and not as tight as the blade. So these are all just, it gives you an idea of the tightness and also the thickness. Now looking over here to the middle section. Now here is tun. Okay, let me write this down. So this is tun. This is the tun position. And this is the guan position. This is the ci position. So in his intake form, you'll always see something here and here because you have the tun guan ci position, right? The 1, 2, 3 positions. And then what is in front here, he's noting the 8 extra meridian. So if you feel any pulses distal to the first position, he will draw it on his intake form over here. I'll show you his intake form in a bit. And if he feels pulses proximal to the ci position, he'll draw it over here on the intake form. So in his intake form, Dr. Chang doesn't write down any words. It's just all drawing and circling of stuff. And I'll show you that in a bit. But that's why we drew the positions like this. Let me erase this so you can see it more clearly. So do you understand that this is tun guan ci 1, 2, 3? Yeah, yes. Can you put yes down for me in your chat room? Okay, good. So now next is this. Okay, do you see that we drew this like, you know, this line and it says roof, right? And then this line it says blade. Oh, the E is missing, the blade. So that means these two pulses only you would find on the guan position. Okay, guitar string, in-chiao pulse, rem pulse, right? See, guitar string is only in the ci position. In-chiao is something that you will see on the ci position, as well as extending proximally to the ci position. There are pulses here, you know, pulses here beyond the Ci position. If you feel your own, you can feel sometimes it extends to half of your forearm, that far out. That's possible. And those are the people with a lot of neck pain and back pain. And then here, the Ren pulse is something that you find like here. See how deep it is? The level. Okay. The color indicates the different pulses. The length of the vessel that we drew out indicates the position. And also the depth, where the line is, indicates the level of where the pulse is found. So the Ren pulse is something that is very close to the bone, pretty much a deep, deep pulse. Okay, so is that clear on how you read this chart here? Okay, so same thing here. The straight, thick pulses, you have the big pulse that's usually in the Guan position, and then the Sao Yang pulses here, Tai Yang pulses the Ci, and then also beyond the Cong pulse, the Du pulse, and the brachial pulse, where the elbow is, we put down here at the very end. So this gives you a good overview of where the pulses are and how tight they are, and also how thick they are. So that's this chart on the thickness. Next page. Okay, turn this off. Okay, next page, the shape of the convex, the bulging pulses. So let's look at that, okay? So when we're looking at a bulge, the question is, how big is the bulge, right? So you can have convex pulses are also called short pulses because they're short, and they could be also long. So the short ones, he calls them like beam pulse, short pulse, convex pulse. The smallest of the short pulses or the bump or the convex pulses is like a bird's beak or a pen tip. It's just like a little ball. And that little ball is pretty much either gallstone or kidney stone. Okay, you can find bird's beak pulse on the left guan for gallstone or on the right Ci or left Ci for urinary kidney stone. So that is the smallest of the bulging pulse. Okay. And then you have the beam pulse, which means there's some sort of swelling or some sort of hernia or some sort of mass, right? Or cyst. And then you have the short pulse. Convex pulse is about 1 centimeter. Tent pulse is about 1 centimeter. Tent, he called it tent just to depict that if you push down on it, it goes away, which is what I was talking about earlier. When a convex pulse is not solid, meaning if you push down on it, it goes away. It's most likely just gas or chi stagnation. But if it's still solid there, it's impossible that it's a tent pulse. Okay. Spindle pulse, turtle pulse, rainbow pulse, sea turtle pulse is just basically getting bigger and bigger and bigger, that bump. So if you take a look at here again, right? This is, let me draw. So this is the Chun position. One, oops, bad drawing. So this is the Chun position, Guan position, and Ci position. So if you take a look, you can see that, the different definitions of the pulses where they would appear on each of the position. So I think this is very helpful for you, at least to know, because, oh my God, in the beginning, what are all these pulses? Can a turtle be at all positions? Gee, no, turtles only appear on the Ci position. And this is wrong. This should be over here. But that's the thing that's confusing about Dr. Chang is that turtle really means the same thing as a convex pulse. And I learned that years after he invented the term. Why do you call them turtle? Why do you call a convex pulse in the Ci position a turtle, but a convex pulse is called a convex pulse when it's in the Guan position? And he said, well, because when it's in the Ci position, there's usually a chance that you will see something like this after it. So see this right here? He if this is the Ci position, he would call this a turtle with a tail, So that means the Ci position, he feels like a bulge, but then proximal to it, he also feels something wiry and extending. So he, as an artist, would like to call that a turtle because it looks like a turtle, right? So that pretty much the convex nature of the pulse in the Ci position, it means soft tissue injury. So if it's in the right side, on the right Ci, it means neck and shoulder. That means there is some sort of neck and shoulder soft tissue injury. But if it also comes with the tail, then he'll call it a turtle. Then that means turtle with a tail. That means there's also some sort of pinching of the nerves. Pinching of the nerves will reflect in that wiry, straight pulse. So that's just to give you an idea that convex pulse is really the same as a turtle pulse. Spindle pulse and sea turtle pulse and rainbow pulses are bigger than convex pulses. Okay, so convex pulses only occupy the space of the position. 寸关尺. Okay, so if it spills beyond the position, like this one, see this rainbow one is like way bigger than its position, which is the 寸. 寸 is like from here to here, right? But this pulse is way beyond. That means this pulse is, you can feel it up here too, not just in the 寸 position. You can feel it up here, distal to the wrist, or a little bit distal to the wrist, maybe not that far. But when he sees that, he calls it the rainbow on the left 寸, but when it's on the right side, it's called a sea turtle on the right Ci. So don't be confused, okay? These are just terminologies. I don't know why he just likes to be, I guess in the clinic, it's kind of boring to see patients every day. So he invents these terms. So it's more fun in the clinic, I suppose. But when it comes down to it, the big picture is that there is just a bulge, okay? The size of the bulge, it just means how spread out is the problem. Like, for example, the rainbow pulse, okay? The rainbow pulse on the left 寸 means the small intestine has a lot of gas, or there's MSG poisoning. So when it's bigger and it's occupying more space than the length of the distance of the 寸 position, that just means the patient is more bloated or the condition is more severe. It has spread to more areas of the abdomen or the small intestine. So it's not just a little bloating here, it's the entire abdomen feels bloated. Does that make sense? Okay, so let me go back here to your questions here, see if there's any question. First position is 寸, yes. Third position is 尺. So this is 寸关尺. So 寸关尺. Okay, here, I think what we were trying to do here, we were trying to just compare these two pulses. This is not 寸关尺 down here. This is just to compare a spindle pulse, is a 3D, and then turtle pulse has a tail. It's just a comparison of these two pulses. I don't think we meant to put the turtle in the 寸 position because it's never in the 寸 position. Okay, you got it? Yeah, there's a lot of clarification needed. Even now today, I I still have a lot of questions for him. Sometimes he has very artistic answers for me. When he doesn't want to answer, he just says, it's my inspiration, you know. Anyway, if you study with him, you'll know. He has classes right now. We're talking about his special formulas. Every month we have a class, and sometimes it's just very funny what he says to the audience. You know, you'll get offended if you're not used to his style of teaching and his personality. He's very blunt and very direct, but he doesn't mean any harm. It's just how he is. Okay, so any questions on this? So just remember, these are curved pulses indicating there's some sort of swelling, some inflammation in the body, some mass, some cyst, or whatever it is. So we had to use herbs that break this kind of mass and break that stagnation. And whereas, you know, there are blood movers, right? That get rid of like masses. Those are the type of herbs that we would use for pulses like this. But if you're dealing with a straight pulse, you don't need to. Many times straight pulse, you need to, if it's straight and thin, you need to use herbs to expand the vessel. And if it's straight and thick pulse, you need to use herbs to calm down the fire so that the vessel will shrink down to its normal size, right? And these are straight pulses we're talking about. But if you're dealing with convex pulses, you had to use something to destroy that mass or destroy that, what do you call that? That swelling. So that the bulge will go away and become straight. So that's your goal. Okay. Question: is the spindle pulse extending deeper beyond the bone? Now, spindle pulse is just something that you can feel. You know, you can feel exactly what you see right here. When you feel the entire vessel, you can feel the top and you can feel the bottom. You can feel, you know, if you move your finger like this on the pulse, you can feel the entire shape of it, not just on top. You know what I mean? If like these pulses here, the pulse on the bottom will be like this, and then you will have a bulge, right? But on the bottom it's still straight. But here you will feel this entire piece, a 3D thing. If you make your hand go around the sides of the radial pulse, you can feel, oh, there's like a like a little spindle or ball, that shape. But you know what? He doesn't talk about this pulse anymore nowadays, no more. So I wonder if it doesn't exist anymore or what, but okay. Okay, so can you zoom in on the camera? Spindle pulse is usually in the Ci position. Yes, let me zoom into the camera, show you what I mean exactly. Okay, so see if I can move my camera. Okay, so if you want to feel a spindle pulse, so this is how your right Sanjiao 4 is here. Put your thumb here. So if you're like this, my styloid process is right here where I marked it, right? So Cun and then Guan and Ci. So when I'm feeling the pulse, see how I'm using the bed of my nail? I'm not taking the pulse like this. I'm taking the pulse like this. So first you lay it down very gently. Make sure your fingernails are not turning white, right? And just with this, you can feel, okay, Cun position should be more superficial. This one should be in the mid position. This one should be deeper, right? So when you first put your finger on it, oh, if you feel, shoot, this pulse is really strong, then something's wrong, right? And then as you feel this, if you want to, what I was talking about is you roll the pulse like this. I mean, your fingers like this, right? You want to feel this side of the pulse, this side of the pulse, this top side of the pulse, right? You can feel the entire radial pulse to move around like this. That's why he says, don't go this way, because you go this way, it's harder to feel. Or if you're like this, it's even harder, right? When your hand is kissing the other hand, how can you move your fingers? It's kind of difficult. So this way is the most optimal. Yeah. Okay. Wrong one. This one? No. I'm moving too fast for myself. This way. Okay, here we go. Okay. Let's see what else. Okay, let's go to the next slide. Okay, so all in all for today, it's best if you can remember that thick and forceful is excess heat. Thick and weak is stagnation. Thin and forceful is constriction, most likely due to cold. And thin and weak equals deficiency. If you master these 4 already for each position, I would say you got half of the puzzle figured out for pulses, because the rest are just terminology and, more sophisticated detailed knowledge that will come to you later. But at least you should get this big picture. Okay, so here is something that I was looking at last week. What I did was I compiled the, 26 classic pulses or 29, I forgot. 29 classic pulses. And Dr. Chang has 68. So on the left, I put the TCM pulses. This is what we learn in school here: swift pulse, faint pulse, feeble pulse, right? And then what they mean. And I put down over here what is the equivalent of Dr. Chang's terminology over here for you. Then for those of you who didn't forget everything from school, you can use this as a reference. Okay. So the first page of this are the ones that are similar. So I put similar up here. Can you see it? Similar in the little blue word here. So these are the similar ones. So like, for example, tense pulse, tight pulse, stringy pulse, wiry pulse is either cold or pain. And for Jimmy, you would be looking at wiry pulse, blade pulse, constricting, pulse within a pulse, Ren pulse, roof pulse, steel pulse, tight pulse, in-child pulse. It's all the same. All of these are what? Can you type in the chat room for me? This right here, all of this, what is that? Is that thick or thin? And is that strong or weak? Tell me. This thing. What pulse is all this? Is it thick or thin? Thin, right? Is it strong or weak? Yes. So it's basically a strong and thin pulse, but they just have to call it tense pulse, tight pulse, string, or whatever. All these terms is all the same. It's just thin and tight, or thin and strong. Okay, so it's really not that hard. So, but then the confusing part is that there are so many terms, and I guess it gets really sophisticated once you're at a higher level. You want to discern the little differences, like poetry almost. But the big picture is the same. Let's go back here. Let's look at this. Let's look at this one. Okay, surging pulse. Okay, all of this is just heat, right? So for this is exactly the opposite of what we just talked about. This pulse here is what? What do you think? Is this a thick or thin pulse? Thick and a strong pulse. And then that just tells you there's excess heat. Right? So it's really not that difficult if you want to simplify it for the understanding of it. Part of the difficulty, I think, is in the feeling, because you just have to feel a lot of people before your body, your fingers become more sensitive, and that your body begins to memorize it for you. Okay. So the next page I have these are the pulses, this page, okay, are the similar ones. And then the next page are the ones that are different. Okay, what are the different ones? Okay, so in traditional TCM, we have scatter pulse, which means qi exhaustion. But scatter pulse, the exact same terminology, okay? It means something different in Jimmy's pulse energy. It means blood stasis. So if you're in his WhatsApp chat room, or you're talking, to the pulse energy group of people about pulses, if you're talking about scatter, we all mean that you're talking about blood stasis. We know you're not talking about qi exhaustion. Okay, so here, same thing, long pulse equals excess yang. But long pulse is also known as rainbow pulse, dew pulse. It could be in different positions, and it means different things. It doesn't just mean liver yang rising and excess yang. It means different things depending on what position it's in. So that's not the same. The traditional long and Dr. Chang's long, they're different. And then next one is the slippery pulse. Yeah, this one is hardest to get rid of. Even I think of slippery pulse nowadays still as dampness, but then, slippery pulse, it means brain damage in Dr. Chang's dictionary. And I have not felt one, and I have not seen him feel one in his clinic either in the 20 years that I've hung out with him. So Maybe because brain damaged patients don't come see an acupuncturist, so we never get to feel this pulse, but that's what that is. And then next one, soggy pulse means dampness, but dampness in Dr. Chang's terminology is a deep pulse. Whenever you see a deep pulse, that means there's dampness. So like I was telling you, deep pulse is a little bit hard to discern compared to a weak pulse, right? When it's extremely weak versus when it's deep, that's kind of hard to tell. So that's just up to you and to practice, right? Because over time, if you keep seeing patients who have a lot of herbs, I mean, not a lot of herbs, patients have a lot of water in the body or chubby patients, and you keep feeling their pulse and it just feels not much there or it's deep, then you're, oh, okay, this is a deep pulse. But then if the patient is not chubby, the patient is kind of skinny, and looks frail and talks like this, okay, that might not be a deep pulse. That might just be a weak pulse, right? So over practice, and when you see the different constitution of the patients and their complaints, then you can better differentiate the pulses. But in the beginning, it's, I would say, pretty difficult. And then you have the sinking pulse, which is in the deeper level. And then deep just means, right? Depends on where it is, the dampness, depending on which location. And then finally, the floating pulse, it indicates disorder in the superficial level in traditional TCM terminology. And Dr. Chang's floating pulse, that's just a level. It doesn't say anything else. You still need to figure out what the shape is and what the jump is. Okay, sounds good. Any questions? Stroke patient, choppy pulse. Choppy pulse is more like a blood stasis or like irregular pulse. He doesn't talk about that. No, irregular pulse. I guess irregular pulse is just irregular heartbeat. That's pretty self-explanatory. I don't think it means anything else. Stroke or Parkinson's. No, he doesn't have any one pulse sign that could diagnose that you have Parkinson's or have stroke. Okay, so coming to the conclusion, I want you to each patient of yours tomorrow, and then for whoever you come across, check the jump and the shape and the level. Okay, so do pulse diagnosis 1, 2, 3, like acupuncture 1, 2, 3. Don't confuse yourself. Always go back to the basics. If you can figure out the jump, the shape, right? The jump meaning the strength, and then the shape, whether it's straight or it's bulged, then you have a lot figured out already. Okay, now next, I'm going to ask you some questions. Okay, 3:10, let's take a break again. And we'll come back at 3:20. And then I'll ask you these questions. Let's see if we can do them together. We can practice what we learned so far already on some of the positions. See if you can come up with some diagnosis.
Recording stopped.
Hello, hello. I hope you are finding today's webinar fun and also helpful for your practice. The best part of attending so many webinars is meeting seasoned practitioners who are generous with sharing their expertise. Their selfless act of kindness will always be preserved in our eLotus library. I have some questions for you. Did you feel like you were on top of the world when you first graduated and passed the exam, and that you can treat every disease and ready to open your practice and help everybody? Soon after, you realize how complicated and different patients are compared to what you learned in school. Do you struggle with treatment results and patient retention? When patients don't return, do you ever wonder if it's the herbs that didn't work or maybe the acupuncture hurt? And for seasoned practitioners, do you ever hit a plateau where some of the patients, no matter what you do, are unable to replicate the results of your other successful patients? Or have cases that are so complicated that you don't know where to begin or how to help the patient? If you answered yes, please type that into the chat room. Chinese medicine is like martial arts. There are many styles and tools. Certain styles and tools are better suited to treat certain conditions than others. So using a single style for all of your patients is a disservice when you have options. Today, you are exactly where you are supposed to be, and in this moment is your invitation to a membership that will change your practice forever. You can train with seasoned practitioners with many years of clinical success. They've done all the work in their practice to overcome the obstacles, and they are ready to share their knowledge to help you overcome yours. You'll be saving decades of study and be on the fast track to becoming the practitioner you are meant to be with any specialty you want to learn. Learning from others' experiences is a much faster road to success than learning everything on your own with no help. Don't you agree? How many of you want to refine your acupuncture technique, learn how to prescribe herbs, or improve your diagnostic skills? And how many of you would be interested in joining a collective in which you only learn from verified experts in our field? The best instructors to teach Master Dong, the balance method, pulse diagnosis, auricular ear diagnosis, herb medicine, functional medicine, herb drug interaction, Japanese acupuncture, abdominal acupuncture, Korean hand acupuncture, practice management, and more. And then on top of that, how many would be interested in getting additional support from TCM vendors for acupuncture supplies and herbs? These vendors would give you resources to help your practice thrive. If you said yes to my questions above, what do you think about having a membership where you can access over 3,000 CE hours and learn from over 200 speakers? I want to introduce you to the path of your dream practice, our eLotus Gold Pass. The Gold Pass is an annual membership to our eLotus online platform where you can learn everything I previously mentioned. This is a great time to do yourself a favor and get the Gold Pass. For those of you who feel it's a good time to reinvest in yourself and be closer to the practice of your dreams, our sponsor Helio will offer you 10% off all your needle purchases, and our other sponsor, Evergreen Herbs, will send an herb voucher for their collections formulas, equivalent to the amount that you paid for the pass. This means that not only do you get your tuition in herbs, but can also resell them for a profit. If there are any Gold Pass members today, please share with your colleagues what you think of the Gold Pass. Is it worth the investment? How has it transformed your practice? Are there any questions for the Gold Pass? If yes, please type them into the chat room. I am happy to answer any questions you may have now as we move forward and continue with the class.
Recording in progress.